In early part of 1970, I was asked to meet with Dr. Russell Lewis and subsequently Dr. Ben Lawton, both of whom were leaders of the clinic at the time. And they had in mind to start an HMO due to the pressure they were getting from Melvin Laird, who at the time was our local congressman. Melvin had been telling them that there was a need to do something about the rising costs of health care. The goal of the plan was try to keep people healthy by taking care of their medical needs before they became ill and required more intensive care.
And it had 4 characteristics, which were the characteristics of the HMO, which were community rating. Everybody paid the same, no matter old or young or sick or not sick. Everyone paid the same. Employers paid the same for their employees that everybody else paid in the community.
It was a feel-good project for the clinic and for me personally to be part of that program, because I saw and I met with people who were they were in tears when they found out that it really did work the way we said it did. It's a good feeling to be part of a plan that had the patient's best interest in mind. And for that reason, I was very proud to be part of the organization that sponsored the Health Maintenance Organization, now called Security Health Plan, but at the time, it was the Greater Marshfield Community Health Plan.
The one thing that has always been a distinguishable characteristic for the health plan has been the experience that our patients, our members, our customers have with the plan. I think that excellence in regard to service puts us apart from other insurers in our area. And people really appreciate that. And I think it gives us a lot of respect, not just locally, but in the state and the nation.
I would say 2 words: service excellence. We have invested and taught and educate people that are not only members of the health plan, but all of those 500 plus people working alongside me each and every day. Service excellence really does differentiate us. We are recognized on a national basis with some of the service accolades that most companies really strive for, including us here at Security Health Plan.
It all fits together so well. The mission of the clinic itself, way back when we first started strategic planning, was certainly to take care of people, period.
What has stayed the same really is our philosophy and our approach to serving our members. Our mission drives us. We talked about that early on. That has not changed. Even though we have grown as an organization, it still feels like a small business. We know mostly everyone. We know each other. We stay connected. We're community focused. And we know that we have an obligation to provide the best health plan for the members that we're serving, but we also have to stay laser focused on the total cost of care for the people that we're serving as well.
And now that we're celebrating the 50th birthday of the Security Health Plan, there were giants at that time that really understood the mission to enrich lives and to really go beyond the 4 walls of the entities that we practice in to really, again, serve our patients and our communities. And I think the fact that we have always put the patient first sets us apart. And that is something that's remarkable, as I've seen many examples across the country where that isn't always the case. So that is what I'm proud of, and something that has been a continuing legacy for us.